I am that nursing prof and welcome to my channel. In today's video, I am going to be answering the most commonly asked, most commonly searched for labor and delivery questions. So let's get into the first one. Anytime you're bleeding, you should go to the hospital to get checked out. If you think your water has broken, you should go get checked out. If you haven't felt the baby move all day, and this is for women who are further along. Women in their first trimester, you're probably not going to feel it, so that's okay. But as you're getting closer to your due date and you're in the third trimester and you're used to kind of feeling the baby move around frequently and you haven't felt the baby move that day, that would be a reason to go see doctor. And then finally, of course, if you're having contractions. And how do you know what contractions are real contractions and what I should go to the hospital for? So fake contractions, Braxton Hicks contractions, if you've heard of those will go away if you hydrate, so you drink a lot of water, if you rest, put your feet up. Real contractions get worse with walking around. They get worse even if you hydrate, even if you rest. They are more painful over time and they should be coming quicker. So maybe you first were taking them and they were occurring every 10 minutes. Now they're occurring every 7 minutes. Now they're occurring every 5 minutes. That kind of stuff. That's how you know that they're real and that they should be taken seriously and that you need to see the doctor. And one other thing you kind of need to take into account here is your access to the hospital. Is the hospital right across the street? If it is, maybe you can wait a little bit longer on those contractions. Or do you live out in the country and the hospital is a 2-hour drive? Maybe you shouldn't be waiting till those contractions are every 5 minutes. Maybe you should go at 10-minute contractions. So those are some things you just want to keep in mind when it comes to contractions and when to go to the hospital. If you don't feel comfortable taking pain medications during labor, good news, you don't have to. It's not our job to force these medications on you. That's not what we do. This is your body. This is your choice. So if you want to go all natural, no pain meds, no epidural, no nothing, we will fully support you in that decision. It is recommended that all women in labor get an IV. And the reason for that is the blood loss that occurs. So if we needed to give you emergency blood, an emergency blood transfusion, it's better that you already have IV access. If you are to get something like an epidural or a C-section, you will absolutely have to have an IV for that. Yes, typically your second baby, your labor will be much shorter. A lot of times it'll be half the length. So if your first baby was 24 hours in labor, your second baby might be 12 hours in labor. Obviously that's going to depend on the individual, but that's pretty common. That's how that works. And as far as it's easier, well, you have experience now, right? You've done this before. It's not as scary. Hopefully it's not as scary because you have some experience in this field because you've given birth before. So hopefully you feel a little bit more comfortable the second time and it will feel easier. Yes, if you're stable and baby's stable and everything's okay, you can definitely do skin to skin. You can definitely breastfeed right away. And in fact, we encourage it. It's really good for you and it's really good for baby. Yes, this is something that happens. It doesn't happen to every single woman, so don't go into the delivery room thinking like, oh my God, this is gonna happen to me. I know this is kind of like a big worry for a lot of pregnant women. Don't be worried about it. It's not a big deal. If it happens, you probably won't even know that it happened because we will do such a good job of covering it up, so you don't need to worry about it. It happens, it's okay, it's natural, it's not a big deal. If you do create a birth plan, we will do our best to honor it. As healthcare providers, as nurses and doctors, our priority is your safety and the safety of your baby. So if we can do the things on your birth plan and keep you safe, great. If complications arise, as they sometimes do in labor, we might need to be a little bit more flexible and make some adjustments. When your water breaks, it might be that big dramatic gush that you see in the movies, or it might not. It might be a little trickle where you even kind of question did I just pee on myself? What was that? So if it is that big gush, you know right away. If it is that little trickle, it won't stop coming. That's how you'll know. And when your water breaks, it doesn't matter how far along you are, if you're preterm, if you're post-dates, if you're exactly on your due date, it doesn't matter. You need to call the doctor and you need to let them know, and you need to get your stuff ready because they're probably going to have you come into the hospital. In most cases, yes, your partner will be able to cut the cord. Be sure to mention that when you get admitted though, that that's what you want so that we can make that happen for you. So that was my video on the most commonly asked labor and delivery questions. Do you have a question that I didn't answer in this video? Go ahead and let me know in the comments below and I might make another video on this topic. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.